Hi there. So, what are the 10 things that absolutely stink about endometriosis? Let's talk about it because I'm a little bit tired of people that haven't had endometriosis or don't work with it, or maybe in the medical field that are blowing it off or not diagnosing it. So, let's talk about what stinks about endometriosis, and then maybe we can share this video and bring more attention to endometriosis because we need a cure. Okay. So I'm Dr. Gina Terranoni, and I specialize in women's healthcare, and I work with endometriosis patients and clients. And I also work with women who've been impacted with fertility health due to endometriosis. And I've helped over 2,000 babies come into this world using natural medicine. So let's talk about it. What are the 10 things that stink so bad? And let's get to number one. And it's not in any special order, okay? Because all of these things are equally awful. Chronic pain. So if you have endometriosis, you know that you can have severe, debilitating pain. And most likely it's every day, okay? But especially during some women, it's like during ovulation. But then some people, it's more intense during menstruation. But it'll impact your daily activities, your relationships, your quality of life, your job. How hard is it to show up with a smile on your face when you're in pain? Number two, fertility issues. Like I said, I work with a lot of patients that have endometriosis and infertility because they've been struggling with endometriosis and they haven't been getting the correct diagnosis, and they haven't been getting supported, or maybe their doctor doesn't even believe them and throws them into another category of just having menstrual cramps, which again, those can be debilitating, but endometriosis is real, it's painful, and it does cause at least 50% of the infertility diagnoses are due to endometriosis. So let's talk about number three, emotional and psychological impact of endometriosis. So the chronic nature of this makes it challenging to get diagnosed. And that creates stress because you feel like, okay, I'm here to be taken care of. I need your help. I need your support. I need some guidance. And you don't get it. So having that happen appointment after appointment, doctor after doctor, year after year, it takes several years for many women to get diagnosed. And 1 in 6 women can experience this, and it's probably higher than that. Okay, so what does this do? I'm preaching to the choir, right? It's frustrating. It causes depression. It can cause anxiety. So it's not just endometriosis anymore. It's a lot of other things because it's like a domino effect of crap that starts happening physically, mentally, emotionally, spiritually in you. Okay, let's look at number 4. Number 4 is uncomfortable or impaired digestive function. Now, I'm sure that you have this if you have endometriosis, but a lot of my patients have it where it can travel or impact specifically the intestines and other areas. It's inflammatory. So you could experience what we call like endo belly. It's bloating, constipation, or alternating constipation diarrhea. And then that further impacts all of your digestion, right? It could even lead to nausea, and there's so many other things. Number 5, sexual dysfunction. I don't like that word, but that's what they say. Sexual dysfunction. Okay, so let's look at this. There's pain during or after having sex. That's common, of course, because you're so inflamed in there. And sometimes you're constantly bleeding, so you're feeling undernourished in that area, and it's painful. So that can cause a decline in sexual satisfaction for sure. But I would say, in addition to the pain, and what I hear constantly from patients is that there's like breakups in relationships and their partner's not understanding. And I think we can tie that into you don't get support for your doctor from a doctor, or you don't get the correct diagnosis and they don't give you a straight line of treatment. So maybe your partner depending on the relationship, starts to wonder, what is this? And why is this bothering you every day? Or why isn't it just bothering you around your period? Number 6, the need for surgery. And if you have surgery to remove the tissue, most likely you will need more surgeries. And this is common. And some women have hysterectomies and some leave their ovaries and they still have endometriosis and endometrial tissue that grows and shows up and still wreaks havoc on their bodies. And it's not, oh, I'm just going to go in and get that removed and then that's done. It's not finished and it's stressful and there's always risk with surgery. It's not just like this quick fix thing. And you know that if you've gone through this, it can take 6 weeks, 8 weeks, 12 weeks. And then maybe there's no resolution, right? You might still be in the same pain. Some women do get relief and then they have a recurrence. All right, number 7, and I touched on this briefly, but it impacts your work. And like I said, it impacts your relationships, impacts your social life. But let's talk about work. It's stressful enough to be in pain, and then you've got to show up to a job and be present and do a good job, because what happens often is these women are getting fired. Any woman that has endometriosis is at risk of losing their job. So let's bring this out into the public and let's talk about how this isn't just you staying home with a heating pad flicking through Netflix. This is you not being able to support or contribute to your family and take care of daily cost of living. Okay, let's put more stress, more anxiety, more depression on top of that. That makes no sense that you're caught in this loop like this. And surely you want to have a career. You want to be able to enjoy your work and not just take jobs that can be like super flexible, but maybe you don't have a passion for them. So it's impacting your career growth. And of course, your social connections. And again, I said the intimate relationships. Okay, number 8. Oh, before we do number 8, will you do me a favor? If you have a friend or if you know of somebody else that's struggling with endometriosis, will you share this video with them? I would appreciate that. And if not, share it with your partner, share it with your family members, share it with your doctor. And sorry, docs, but this is the truth, and that we really need to spend more time with patients that possibly or do have endometriosis. Let's see. So number 8 is struggle with treatment. There's no cure. Treatment can be ongoing. It's complicated. And what happens is a lot of people just get pain management drugs. So then again, it goes back to the job. How are you supposed to focus if you're medicated? Or hormone therapy and then surgery. And then so this physically takes time and possibly losing work, but there's a financial burden that shows up. Is your insurance even covering all of this? Who knows? Okay, number 9. And it travels, right? Endometriosis, often it's located in the uterus, but it travels to other areas. It can impact other organs in your body. So it's not just isolated. So when somebody tells you, just put a heating pad on or do this, yes, or castor oil pack, that can be helpful. If it's only located here, what if it's traveled to another part of your body or to a different organ? And often it can create issues with bladder and bowel. And then that leads to further complications, which brings me to number 10. Your entire body is what gets impacted by endometriosis, not just one location. You know that. So we have to look at mind, body, chronic physical issues like endometriosis. It's just a ripple effect across all of your well-being, and it's miserable. And we're trying to get to the bottom of this. So what do we have to do sometimes? We have to shout out what is wrong. What are the 10 things? But guess what? After I wrote down the 10 things, I was like, there's way more than 10 things. So what I want you to do is post in the comments and tell me, what did I miss? I already had somebody message me and I was like, that was a good one. Maybe I'll share that in the next video. But tell me, how is it impacting you, your life, your work, your family, your relationships, your finances, your entire sphere of who you are? is certainly being impacted by endometriosis. Let's make it stop. Let's get you help. Go in the comments. I'm going to put in a free, like a download for you for endometriosis pain. It's a start. It's not a cure. Not yet. So spread the video. I'll see you soon.